The burgeoning crisis in Medicare Advantage plans. I'm Mark Harrison, and a special edition of Labor This Week begins now. It's a choice we all face sooner or later. Do I choose to have a traditional medical care supplement policy, or do I go with a newer Medicare Advantage program? There are pluses and minuses for both, and Americans seem split on which type of insurance is better. And to make matters worse, even more confusing, every fall we get to think about it all over again when open enrollment begins, with a deluge of advertisements and television commercials and junk mail that causes most of us to simply throw up our hands in frustration and stay the course we are on. But what happens when we have been made promises from our employers and from our unions about these coverages in old age, and those promises suddenly change? What happens when we are forced onto a program we never wanted and are told if we refuse to make the change, we will suddenly have to begin shouldering the cost of some coverages on our own? Well, that's exactly what is happening in cities and states across our country. And in an attempt to shine a light on this burgeoning crisis, we have two guests with us today. Joining us, Marianne Pizzitola. She is retired from the Fire Department of New York as an EMS worker and the founder of FDNY EMS Retirees Association. And currently, she serves as the president of the New York City Organization of Public Service Employees. As well, Jeff Johnson is joining us. He is the co-president of the Pugent Sound Advocates for Retirement Action, formerly a college professor and the former president of the Washington State Labor Council, representing more than 500,000 workers. Welcome to both of you. Marianne, I want to begin with you and what's happening in New York City. Can you give us an overview on this?
Sure. About 2 years ago, our former employer and our former unions made a deal to try to push us into Medicare Advantage plans, stripping us away from our hard-earned benefits, traditional Medicare, and our city supplemental plan. We filed a lawsuit. We won. The city appealed. We won again. And it seems like they just keep trying to go around the judge's decision to make sure that we end up in a Medicare Advantage plan, a plan that we're not really happy with.
And this is something that's being played out not only in New York, but in fact something that is increasingly playing out across the country. Jeff, tell us what's going on in Washington State.
You bet, Mark. Thank you. And thank you, Marianne. Last year there was an attempt in Washington State to take away the traditional Medicare option plan for public retirees in Washington State. So RPEC, Retired Public Employees Commission, reached out to PSARA, my organization, as well as others, to join them in the battle to stop this. And we got both the union, AFSCME, involved on our side, as well as the current governor, and we were able to stop that. And so they pulled back that proposal. So right now, public employees can be on traditional Medicare, and most of them prefer that. I will say this, the other thing that happened last year is PSARA, Pugent Sound Advocates for Retirement Action, we began a campaign to try to get President Biden to eliminate, to stop the ACO REACH program, which is kind of Medicare Advantage on steroids. We were unsuccessful in doing that. The pilot started this January 1st. However, we built up an enormous amount of allies, both in our state and across the nation, in bringing attention to the negative aspects of privatizing Medicare.
Where do you see that going from here, from where what you just explained going forward? How do you guys see that shaking out? Jeff.
Okay.
Yeah.
Well, our organization continues to work in our own state with unions, with social service groups, with senior groups, youth groups, faith-based organizations to convince our congressional delegation that we need to eliminate privatized Medicare and we need to strengthen traditional Medicare. But we've also reached out to national organizations because this has to be a national fight. Right now, for the first time in history, there are slightly more people on Medicare Advantage programs than there are on traditional Medicare. And it's It's not surprising in some senses. As you mentioned in your prologue here, most folks are confused when making this choice, and there's a barrage of commercials on TV convincing them to go in one direction. But actually, in our analysis and talking to folks, it's not the additional benefits necessarily that take people to Medicare Advantage, but that on average, they only pay $18 a month in premiums versus traditional Medicare, where you pay about, on average, $250 a month in premiums. That doesn't have to be. That was a policy choice and a political choice. The money to subsidize Medicare Advantage programs comes out of the Medicare Trust Fund that all workers paid into. So there is not a level playing field. If there were, we believe most people would choose traditional Medicare.
Sure. According to the New York Times, a study conducted by Brown University found that Advantage beneficiaries were less likely to enter the highest quality hospitals, less likely to be admitted to the highest quality nursing homes, and far less likely to use the highest rated cancer centers. Marianne, tell us exactly how these Medicare Advantage plans are so adversely affecting retirees in New York.
So through the course of this litigation in the last 2 years, we have learned that many of our retirees have sent us notarized affidavits, even their providers have, that they are not accepting this plan. Their providers are not accepting it. I mean, of course, some are, but there are a lot that aren't. Hospitals are not accepting it. We have retirees that are in continuing care residential communities. These are mostly single seniors who go into independent living and can transition to assisted nursing or memory care. These are facilities that have a medical director that take care of you throughout all stages of your life. They do not accept HMO and MA plans. You sign a agreement like a lease when you move into them, and they govern your health care. They make your decisions whether you go to the hospital or skilled nursing, and they don't accept Medicare Advantage plans. So if you are forced into an MA plan in this situation, this is your residence, like you live here. What's going to happen to you? These people will either be forced to lose their home or bear the full burden of the cost of health insurance. And then, of course, we have these plans with a narrowed network. You're using in our situation, this time around, it's Aetna. They're saying it's a PPO plan, but you have benefits in network and out of network. But the in network is obviously the easy ones. But if your doctor's not accepting the plan in network or even for payment, you're then burdened with the administrative procedure in mitigating your own billing, which is ridiculous. So in a nutshell, that's that's kind of where we are with this. Medicare Advantage plans were always meant to be a choice. They don't serve everyone. Even they ask you an added benefit of the prescription plan. They're telling you have to take their PDP, private drug plan. Meanwhile, many of our retirees have a plan on the outside, even from Aetna, that the monthly premium is between $6 and $79. The plan that they're offering through this plan is $135 a month, and the formulary is way different than what they're currently paying. So not only is the premium exorbitant, but then so is the drug cost. I don't see how this is a savings or a benefit to retirees.
Right. And staying with you for a minute, Marianne, the article in the Times also suggested that frail people with chronic issues who were frail and more likely to stay with traditional medical care we're going to suffer with this more. And the city is trying to force retirees to pay previously promised amounts to stay with traditional Medicare. Are we looking at a lot of 9/11 first responders who have developed chronic conditions being affected by this adversely?
Yes, I am one of those 9/11 responders. So you have two kinds of 9/11 responders. You have those first responders, and then you have survivors. The first responders are mostly covered by the World Trade Center program, except if your condition is not certified with them, like some of these cancers yet aren't approved. That has to come out of your health care. And that becomes an issue, especially under Medicare Advantage plans. Many of these specialized cancer centers don't accept Medicare Advantage plans. That becomes a problem when you want to make sure you get the best health care, but then those best facilities don't accept these MA plans. And then you have survivors. These are your civilians. And the civilians have to use their primary health care as their first line of defense. But if these plans are the same way in that they preclude, they're not accepted by these better physicians or practices or treating facilities, then you're not getting the best care that you can because they're not in the Advantage Plan network. And what? So I think it's a burden. It's a burden to everybody, and especially this population. We've been lied to by our city. The city put us in this situation, told us go back to work. The air is safe. We got sick. They're still lying about it. The current mayor doesn't want to release some of the information because he knows that it would hold the city negligent. And then now he's trying to take away our health insurance that we've had since 1966. I don't understand this. It's appalling.
Let's stay with that a minute. With what the mayor is saying, the CFO for New York City, for the city, Brad Lander, says he's got very serious doubts. What's going on there? Can you give us a little view into that?
So the city has reported that by doing this, they would save $600 million a year. That number really hasn't been vetted. We've been saying for 2 years that that's kind of inflated and that it would never have saved $600 million a year. And we say that because the actuary report on what our Medigap plans cost, they say it's 250,000 retirees. The actuary report reported the last time 183,000 retirees at a city cost of $439 million. Where that other difference would come from, I have absolutely no clue. However, they also built into the contract that Aetna would charge the city of New York $15 a person a month to waive more prior authorizations out of the plan, because that was one of the things that we argued with. So for an additional $15 a person a month, the city would remove a burden of some of those prior authorizations. Therefore, the savings was not going to amount to $600 million. His last statement publicly that I saw was it would probably be between $200 and $300 million. And while that still is a savings, his last comments to the press was that amount could have been found someplace else within the budget to continue to stick to the promise that was made to retired persons.
And Lander has to sign off on this for the mayor to agree to. Is that correct?
Well, he has to register it, and he's only allowed, he has a very narrow structure of rules under the charter of the city. He can not refuse to register the contract based on problems with the procurement or problems with the contract or it not being funded like the last time. But even if he doesn't register it, he refuses to register it, the mayor could overrule him and do it anyway.
Oh, I see. Jeff, how do we come to find ourselves here? Is this a policy problem? You kind of touched on it before it had gone to Washington. Is it a political problem? Why are we finding ourselves here? And is part of it have to do with the fact that it's ignorance on the part of the population?
Well, if I could answer that this way, Mark, it is both a policy and a political problem. But I want to take a step back. Folks on Medicare Advantage, you're right. There are mixed results. If you're a healthy younger retiree, not too sick, the Medicare Advantage program may work out well for you. Certainly for low-income seniors, paying $18 a month on average in premiums, that makes it attractive. Having additional vision, dental, and hearing benefits, though they are not very elaborate benefits, are some benefit as well. But here's the deal. Medicare Advantage programs, I mean, the beauty of traditional Medicare is that I go see my doc, we make a decision about my health care, and then I get to go anywhere. I don't need any prior approval. I can go to see any specialist I want that accepts Medicare, right? With Medicare Advantage, you mostly go in network, otherwise it costs you an arm and a leg. Everything has to be prior approved before you get that. And as the New York Times and even the Inspector General from Health and Human Services has shown, is that MA programs, they make a lot of their money through delaying care and denying care. And that, in fact, in the year 2020, between 12 and $24 billion of fraud was committed by Medicare Advantage programs, money that comes directly out of our Medicare trust fund. And that over the last decade, $105 billion of fraud has occurred. So how does that impact seniors in Washington State and around the country? It significantly decreases the quality of care and the quality of life for many of our seniors. Now, how did we get here? It is both a policy and a political problem. Historically, when Medicare was passed in 1965, President Johnson had a task on his hand to pass that. A Southern strategy got created, right? He did create what was basically national health care for seniors in the United States, but it didn't cover every dollar. There was a Medigap problem. 20% of Medicare expenses were not going to be covered. Why was that the case? Many believe historically because it was a racist policy forced on us by Southern senators who didn't want Black and brown people to be sitting in the same hospital waiting rooms and doctors' offices as white folks and so forth. So they created a 20% gap that if you're a poor person, you cannot afford to pay, and then less people would be going to use these services. Unfortunately, that discriminatory policy has impacted everyone, and for the past 50 plus years or so. They also created a market for the insurance industry. So privatization has been part of the system from the beginning, should not be. There's no reason. My wife and I pay $5,000 a year to combine for our Medigap policy. Why? They don't do anything. They make no medical decisions. They just determine, well, we'll pay X percent of your bill, but they make no medical decision at all. Political. It's a political problem. Why does Medicare Advantage, why are they able to offer dental, vision, hearing, some transportation costs? Why are they able to charge low premiums? Because they're being subsidized by our tax dollars, right? Traditional Medicare is not. Why is that happening? Too many politicians, both Democrats and Republicans, are beholden to the largest corporate lobby that the United States has right now. And I'm going to give you an example from my own state, though they are worldwide in nature. Amazon Corporation just purchased One Medical and Iora for $4 billion. Both of those subsidiaries make more than half of their profits in the Medicare system. Why would Amazon be doing this? And I think the reason is, Mark, is that, it used to be, Social Security is the third rail of politics. We've learned that, for decades and decades. Medicare also should be included as part of that third rail, because it's estimated that Medicare expenditures annually will reach $1.6 trillion within the next 3 or 4 years. Think about that. If you're a Medicare Advantage program, 15% of every Medicare dollar goes towards your profits and overhead. If you're an ACO REACH program that's being piloted now, up to 25% of every Medicare dollar will go to profit and overhead. So it doesn't take a rocket science to figure this out. For corporate America, Medicare, they stand to make between $240 billion and $400 billion a year in profits off of privatized Medicare. We got a political problem. We got to change this.
Yeah, well, it doesn't take a rocket scientist. You mentioned Amazon. Jeff Bezos has a rocket company, so I don't know if that has anything to do with it or not. Retired people, let's stay with this for a minute. Retired people vote. They come out and vote, and that's why the third rail that you termed for Social Security, right? And we're entering this season already, believe it or not, for 2024. How do we get this to become a talking point in Washington? How do we get politicians to actually care about this? Let me start with you, Jeff, and then we'll come back to you, Marianne.
You bet. Thank you, Mark. So look, you're right. There's a lot of misinformation out there. Passara, we do a lot of webinars. We go out into the community and educate around Medicare and Medicare Advantage. And when folks understand the difference, they're aghast that the U.S. government is allowing privatized companies to privatize their Medicare system and basically rob the system. And so they want to do something. So the more education we can do out there, the more advocates you bring online. In terms of politicians, we got to call them out. Whether they're friends or not, we got to call them out. We've taken out full-page ads in all the newspapers in Washington State twice now, calling out our delegation. Are you for privatized Medicare and profits taking away healthcare dollars from seniors? Or are you for seniors and increasing benefits like vision, like dental, like long-term care for seniors. And we just ask them point blank, and we also go to all their town halls and we pose those questions. Who are you with? Are you with the corporate America, or are you with your seniors?
Marianne, your thoughts on how we get the attention of the oh so many politicians just around the New York City area?
Well, we've been struggling with that. In addition to litigation, which we're starting up again, this will be our third case against the city. We are also have been trying legislation on the city side. The city council persons don't want to take up our legislation. We slimmed down our bill to simply even 2 sentences, and I've been meeting with them all week again since January. Every week, every month, they just don't want to do it. The mayor is insisting that this is what he wants, and the speaker is threatening the city council members with their discretionary funding, that if they take the side of the retirees, that they won't get their discretionary funding for their districts. We started a Facebook page for on a national level. It was just something I started with a group of retirees from Delaware, and we named it NOSOM, NOSOM, and it was National Organization to Save Original Medicare. And just to do action network campaigns to click in your name, address, information, and to communicate with your local, state, and federal legislators, because we are in this situation because of a federal rule. There's a federal statute that was changed in the year 2000 under Bush Sr. that allowed the secretary to create a rule where you could be seamlessly transitioned into Medicare Advantage plans if you were in an employer group waiver plan, or EGWIP for short. And since most unions and employers have these group plans, it allowed them to seamlessly transition their seniors from original Medicare into Medicare Advantage. No open comment period, anything. And we learned about this in 21 when we were filing our litigation. It was actually we were written about, and this situation of auto enrollment into MA plans, by MedicareAdvocacy.org in Connecticut. David Lipschitz is in the DC office, and we learned a lot from him from this process. And if I think this is going to stop on the state level, it needs to be stopped on the federal level. And it's almost as if, and I think I might have said to you, I'm not a conspiracy theorist and I'm pretty fact-based. However, if you start to watch what's happening where federal employees are being auto-enrolled into Medicare Advantage plans, state employees and union employees are being auto-enrolled into Medicare Advantage plans, taken off traditional Medicare that we have paid into from the very first paycheck we earned as a kid. Is this a national type of conspiracy to privatize Medicare from within the inside? Why are we even addressing this? Why hasn't this rule been rolled back? So yes, we started this campaign it's like I don't have enough fights, to not just fight it on the city level, to fight it on the state level, to fight it on the federal level, where really if they rolled this back, let insurance companies, if their plans were so darn good, people would automatically go into them or volunteer to go into them willingly. They would opt into them, not have to be forced into them. Because right now what the city is telling us and what other municipalities telling other retirees is you take this Medicare Advantage plan or you take nothing, because that's what's happening to us right now. And everything that they promised us, our Medicare B reimbursement, our welfare fund drug plans, prescription vision, dental, whatever, all of that will go away if we don't do what they want. And meanwhile, you're in your 70s, 80s, 90s. I have a retiree who's 102. How is she going to read a 100-page EOC?
Right. Let alone file forms, file claims, file protestations. Where are you right now in New York? 250,000 retirees. You guys are heading back to court soon, right?
Yes, we're filing a brief to challenge this, as well as a restraining order to stop them from doing it. And at the same time, I'm still fighting with the council to take up the legislation that we have slimmed down to 2 sentences. And that's what we're trying to do. The 2 sentences of our bill is the city must offer us a Medigap plan, and nothing contained in this bill is prevents the unions from collectively bargaining, because what they're telling me, the council's telling me now, is that my legislation is preempted by the state Taylor law or New York City collective bargaining. And I said, no. You don't understand anything about unionism. I am union, I am labor, I am retired union. And under the Taylor law, prevents public employees from striking, and it also empowers a union to collectively bargain for those in their unit with wages, hours, and work conditions. On a retiree, I don't have any of those. So they keep telling me go collectively bargain, and I'm like, okay, boys, let me in the room, and they're like, no,
Right.
you're not allowed at the table. So I have to keep reminding them if I am not invited to the table, then I must be on the menu.
And the Taylor Law, just for our viewers, is a reference to a law in New York State that was enacted way back in 1967. And there were a lot of provisions in it, mostly to keep public employees from striking. And
Correct.
and they're trying to say, hey, you people that are out of the union, and it had only everything to do with collective bargaining. Now that you people are retired and out of the union, oh, it covers you as a union member. But I guess what you're saying is you're not a union member if you're retired, right?
No, no, you can't be. And the Taylor Law and New York City collective bargaining make that they were both put in place in 1966. And actually, by these gentlemen behind me, these are all our labor leaders. Bernie Rosen used to be the comptroller's office. I keep saying to them, "What would you do, Victor?" Because Victor used to run DC 37 back in the 60s. Like, these were the radicals. They went to jail for civil rights, for unionism, to make sure that you had collective bargaining rights. What would we do? And yeah, so the Taylor Law prevented us from striking. We're supposed to sit at a table and negotiate. But if the Taylor Law empowers a union to collectively bargain for those in their unit for wages, hours, and work conditions, and I don't have those, they don't represent me. My union doesn't send me a card. They don't send me a calendar. They don't give me a hug at Christmas. I get nothing from them. But yet they were free to negotiate away my health care to make sure theirs stayed premium free.
Right.
But I don't get anything from them.
After collecting dues from you for an entire career.
Lifetime, yes, absolutely.
Yeah. All right, we're getting short on time. I'm going to go to final thoughts from both of you. Jeff, begin with you.
Thank you. So I guess I want to say this: seniors, both union and non-union, face an existential health crisis right now. If you take a look at some of the things that Dr. Liz Fowler, who's the head of Centers for Medicaid and Medicare Innovation, something that was created by the ACA, she wants to see all Medicare beneficiaries in an ACO REACH or MA program by the year 2030. What she's saying is she wants to see a 100% privatized Medicare system, one that takes larger and larger percentages of each Medicare dollar to go towards the profits of private corporations. This is not good for seniors in this country. It's not good for the healthcare system in this country. We should have a 100% publicly funded, publicly operated healthcare system for seniors. And for others, Medicare for All would be one way to get there. Simply leveling the playing field between traditional Medicare and the Medicare Advantage programs would be another way to get there, because I think if you did that, most seniors would choose traditional Medicare. They don't want a corporate entity telling them whether they can have a procedure done on their health or not. They'd much rather trust their doctor and that relationship.
Something that every 25-year-old who may still be watching us on social media, although I doubt it, should be paying attention to, because it is going to affect them down the road. And this is why this is a political issue that has to start with the retired people that are being affected, and it needs to become a very large public issue that's debated as we lead into national elections and even a presidential level election. Marianne, your last thoughts.
I do agree that this does need to be a national conversation. Young people today don't seem to understand that your health insurance changes when you turn 65 years old. They don't understand Medicare. A young person recently told me, well, if I have to sell that old people's insurance in order to get a raise today, then I'm going to do that, because then I'd have to be here for another 40 years to even see that insurance. There's a complete disconnect, and they don't understand that your needs change as you get older and how this insurance is different than theirs. And I do think that they do have to be part of this argument. We need unions, especially in New York. And I'm sure around the country, I would think you would agree with the same argument. But we need honest labor leaders to make sure that they are protecting what was earned by the labor unionists, the people that worked before them. We, in our situation, we built our city. After 9/11, we rebuilt our city, and we built our unions. I don't understand this disconnect with them, where they're okay to sell off something that a retired unionist earned and paid for. And I think that's just abhorrent. And there's not even in our national unions, the AFSCME or AFL-CIO, getting involved in this messaging. And that's even more disturbing to me. that no one is defending us. No one is coming and saying to us, let us help you. We're fighting this fight by ourselves and with other retiree groups around the country. We only have ourselves to work on this. And I think that's another struggle, is how do you organize retirees?
Well, hopefully the three of us sitting down today to have this conversation will begin a larger conversation, and we can continue to build from there.
Amen.
I want to thank you both for joining us today, and for everybody out there for joining us. I'm Mark Harrison for Labor This Week, and I'll see you next week on Labor This Week.